Okay, so I can see from your pre-consultation notes today that your presenting complaint is your back. Yeah, okay. All right, sweetie. So the way I like to do my consultations is, of course, we'll take a really detailed history, all right? But what I also like to do is, as I'm asking you these questions, I like to just work around you just so I can get a little bit of a better idea as to the specific areas in question, and it also allows me to just further personalize your consultation today, okay? Beautiful. Are you comfortable in that chair? You're comfortable as you are? Yeah, okay. Wonderful. If at any point today anything makes you feel uncomfortable, if you would like a break, if you'd like just a few moments to just kind of gather yourself, absolutely fine with me, okay? Yeah, beautiful. All right, sweetie. I am just going to start on this side, and as I said, I'll be asking the questions as we're going along. All right. So first of all, just start by telling me where the back pain is located. Is it your upper back, your lower back, your mid back? Okay. So predominantly your lumbar area. Okay. Do you feel it more on one particular side, or do you feel as though it's kind of evenly distributed? Okay. Just lean you forward a little bit, sweetie, if you can. Just press there a little bit. Does that feel okay? Yeah, okay. Just let me know if it's... Yeah, there's a little bit stuck there, isn't there? Actually, it feels a little bit... Yeah, just keep still for me if you can, sweetie. Thank you. Okay. For this portion, just because it is predominantly your lumbar, are you okay to just stand up for me? Thank you. Beautiful. Yeah, if you just stand up and come a little bit closer. Beautiful. Just gonna kind of reach around there. Okay. So it's more on this side. Okay. And just lean a little bit more forward for me, sweetie. Thank you. Yeah, just gonna press a little bit harder there. Just let me know if that's too much. And yeah, there's a definite difference. Okay, sweetie, what I'd like you to do now, step a little bit more forward for me if you can. Yeah, there's almost a little bit of a drag on this side, isn't there? Okay. Yeah, okay. Let's try and loosen a little bit if you can. The muscles are a little bit tense on this side as well, I think, so just try and relax if you can, okay? And did you feel as though it was a gradual onset? Yeah. Yeah. So sort of a twinge that's developed over time. Okay, gotcha. Okay. Just step back for me. Beautiful. What I want you to do now is just try and open your hip area a little bit. Wonderful. And I'm going to press. Is that okay there? Yeah, okay. There's a definite difference on this side. Let me see. And just kind of open your hips a little bit more. Don't worry, that's okay. Yeah, beautiful. Okay, no specific injury, no incident, accident that you're aware of. No, okay. No new gym routine, exercise program. No, okay. So what I'm going to do is just lift your arm up here. Do you feel as I'm lifting your arm, Do you feel any dragging, any pulling sensations? No, okay, good. Okay, and any numbness, tingling in your legs, any altered sensations in your legs? Okay. Right, okay, we're just going to pause the back pain then just for a moment. Just want to make sure there's not any underlying nerve root irritation there, okay, or some sort of compression going on. Just lift this leg if you can, this one here, just for a moment. Yeah, and lift that one for me. Okay, and then step back. Beautiful. Okay, I'm just going to press here. And if you can just lift both of your feet up for me. Okay, and just flex your feet back and forth like that. Okay, and how often are you getting that sensation? Okay. Right, okay. Yeah, have you ever been investigated by your GP for this? Have you had any MRIs, X-rays? No, okay, don't worry, sweetie. So step forward for me again if you can. Okay. Just going to press here. I want you to let me know what that feels like, okay? All right, and just, if you can, just kind of lift both of your shoulders up and then step forward. Okay, yeah. Let me just jot this down. So, okay, step forward for me again. Yeah, okay. And there's a little bit of a pull there as well, isn't there? Okay. And you said about 4 times you've had that sensation. Okay. All right. Have a look. Does that feel okay? Yeah, all right. As I said, sweetie, just go ahead and let me know if at any point you feel uncomfortable. I'm just going to reach over you there, sweetie. Just going to stretch that arm out a little bit. Can it go any further? Beautiful. Okay, and back down again. Wonderful. And then just going to stretch that one right out. Beautiful. Okay. Okay. When I'm pressing here, do you feel any altered sensation in your feet, your legs? Okay, good. And what about there? No. Okay, good. Okay. So as I said, what we do need to make sure is that there's not something underlying going on here that is maybe outside of the scope of what I can fix, okay? Now, I don't know how much you know about the anatomy of the body, the structure. Yeah, no, that's okay. Don't worry. That's absolutely fine. So, essentially, is that okay? It's not pressing too much, so okay, beautiful. So essentially your back is, it's of course made up of vertebra or bones, and these bones are stacked on top of one another, okay, almost like little building blocks. And between each bone is something we call a spinal disc. So it's almost like a little soft cushion or a jelly donut, and they kind of act as shock absorbers, okay? Then running down the middle of the spine, we have a bundle of nerves. So we have the spinal cord, and then of course we have the spinal roots. And I'll just kind of show you. So at each level, the nerves will be branching off, and they travel down your hips, your legs, and into your feet. Now, what can sometimes happen is if one of these discs becomes sort of pressed, this is where I think is where something like that may have occurred. If one of these discs become worn, it bulges, or even if it just slightly slips out of place, it can press on those nerves and irritate them, okay? And when a nerve is irritated, the signal it sends to the brain can get a little bit mushed up. So instead of carrying a normal sensation, it sort of fires off extra signals, and your brain misinterprets this as tingling, pins and needles, burning, numbness, that sort of thing, okay? And I'm just concerned because you said you did feel that, and you have felt it quite a few times, okay? It's something we'd call radicular features. And they can be red flags. It can sometimes be muscular. Sometimes muscular can place a little bit of pressure. Generally speaking, we do need to rule out nerve involvement first, though, okay? So, from the consultation and the way you've described the pain, we would need to be ruling out any kind of L4, any L5 irritation with an MRI, okay? Yeah, wonderful. So what I will do, I'll send a referral across to your general practitioner. I will send that as semi-urgent just to make sure we're clarifying that for you as soon as possible. What we're able to do today then is make some light adjustments, but strictly in your shoulder and your neck area, okay? So I wouldn't be able to adjust anything with your back today. I don't want to go ahead and go in there if there's something underlying, okay? Does that make a little bit of sense? Yeah, wonderful. Let me just make a note to send that referral across. And you said it's tingling. Let me just see. And it's more there, isn't it? So, yeah. And just flex your toes and your feet for me again, just to double check. Yeah, no difficulty in doing that. Okay, wonderful. And no issues with bladder. No. And no reduced sensation anywhere else in your body. Okay. Beautiful. All right. So I'll go ahead and have my receptionist send that off for you now, just so we can get the ball moving a little bit quicker in that regard. Now what I would like to do is focus on your shoulders and your neck, okay? Wonderful. So for this, what I'd like you to do is just, your shoulders are quite upright. I'd like you to just relax them. Beautiful. And yeah, there's a lot of tension there. So there's a little bit of work to be had there. I do feel like some of this may actually coincidentally help the lower back, but as I said, we really want to just make sure we're ruling out any nerve involvement. So we'll go ahead, send you for an MRI, but we can focus on this. And as I said, we may get some relief. Okay. Just gonna kind of pop your shoulders back a little bit, just gently. So I'm just gonna press down. I just want you to kind of, if you can, resist. Yeah, resist. Just push back. Beautiful. Good strength there. Okay, and just roll your shoulders a little bit. Wonderful. Just gonna kind of, yeah, there's a little bit of a restriction there. Does that feel okay? Yeah, okay. And just roll again. This time roll forward and roll back. Wonderful. Stretch this arm again. Just keep still if you can. Perfect. Okay, and just gonna work on this, so just on your glenohumeral joint. So just loosen if you can. Take a deep breath in. 1, 2, 3. Wonderful. Okay, feel okay? Just kind of shrug your shoulders a little bit. Beautiful. Same on this side. Just relax if you can, sweetie. Thank you. So again, the glenohumeral joint. 1. Deep breath in. 2, 3. Perfect. Okay. Okay, just gonna go down to your AC joint. Just relax your chest. Yeah, wonderful. Yeah, a little adjustment here. Just breathe in. 1, 2, 3. Beautiful. Same on this side. Relax. Wonderful. 1, 2, 3. Okay. Does that feel okay? You can instantly feel a bit more movement. Beautiful. Yeah, so there's a little bit of restriction in your sternoclavicular joint. So just breathe in for me. Just gonna press a little bit hard on this area, okay? If it's too much, just tell me straight away, but I think there's a really nice adjustment to be had here. So 1, 2, 3. Okay, feel okay? Good. And just same on this side. 1, 2, 3. Beautiful. Okay. Just roll the shoulders again for me. Thank you. Okay. Just gonna see what movement we have with your neck. Yeah, just try and resist with me if you can. Push against. Beautiful. Yeah. Okay. Yeah, and if you can just look towards the window for me. Beautiful. Okay. 1, 2, 3. Beautiful. 1. Yeah, you're okay. Just keep on looking at that window if you can. Thank you. 1. Yeah. 1, 2, 3. Perfect. Okay. I'd like you to now to just look towards the other window. Beautiful. 1, 2, 3. Does that feel okay? Yeah. Just kind of move your neck a little bit just to make sure everything's moving good. Beautiful. Okay. And if you can look up and then look down for me.